Welcome to A State of Sight. I'm Isaac Porter, and this is your update in ophthalmology and eye care. And today I would like to answer a question we had on Twitter by Dr. Asan, who was wondering, how can dry eyes affect the cornea? Now, this is a great question. We haven't covered it yet. And the important thing about dry eyes is that with dry eyes, you don't have a good tear film covering over the surface of the eye. Now, if you look back to A State of Sight number 14, I go into detail about the tear film. But basically, there's a watery part, an oily part, and a small mucus part that make up the tear film. Now, this mucus layer is the most inner layer, the back layer of the tear film, and it directly rests on the cornea in the front of the eye. Now, the cornea has very fine filaments that stick out from the surface of the eye, and the mucus layer actually binds in and around these filaments to help the tears stick onto the eye and help stabilize the other front layers of the tear film, the watery and the oily part. Now, with this, the most important function of the tear film is to make sure the light can pass smoothly into the eye. Now, the cornea is responsible for letting this light come in clearly, and if the tear film is unstable or breaks up too quickly, that's one of the main reasons that patients with dry eye syndrome can have inconsistent vision, where it's good sometimes, bad sometimes, because the tears are not smooth and stable to let clear light pass through. Now, in the examination, we can see with dry eye syndrome that there can be small spots on the surface of the cornea from the dryness. We can use special stains. A couple of names you may hear would be a fluorescein stain, or sometimes rose bengal or lissamine green, are different types of dyes or pigments that we can put in with the tear film that can bind to these areas on the cornea where there's dryness. These small spots we will call punctate epithelial erosions. We say PEE for short. Sometimes they'll be called SPK, or superficial punctate keratitis. But in these areas where we see these spots light up on the cornea with the stain, there are cells on the surface that are dead or breaking down or unhappy where they've been exposed from the dry eyes. Now, more severe complications on the cornea from dry eye syndrome could be Salzmann's nodules, which are basically uneven bumps, a little bit like scar tissue, that can distort the vision, especially if they're in the center. Or severe dry eyes can get filaments or small extensions of cells that can be very irritating to the eyes. Now, if you have any other questions about dry eyes and the cornea, please post. We'll be happy to answer them, and hopefully see you again soon next time on A State of Sight.